In Uganda, over 3,000 people lose lives annually attributed to drowning according to research conducted by Makerere School of Public Health. Children between the age of 5 years to adults aged 25 meet their untimely death. Businge Otto is a researcher at Makerere University School of Public Health in the Department of Trauma, Injury and Disability Unit explains the research findings.
Aside being statistics, when you listen and hear that 3,000 people have died, when you listen to it as a number, it may not make sense. But when you count 3,000 bodies in front of you, or listen to a story of a mother who has lost a child, or a father who has lost a son, that's when it becomes a concern. Of course, findings from the research conducted by School of Public Health found out that over 70% of these cases happen in lakeside districts. These are districts that are neighboring lakes, especially the Lakes Albert, Lake Choga, Lake Victoria. That's where most of these cases are happening. And rural and peri-urban areas are the mostly affected.
Lack of access to clean and piped water in areas surrounded by water bodies is the leading death trap, where children are sent for water from lake shores drown.
In villages, let's say like in districts of Rubirizi, they are surrounded by deep lakes, wells, and this is where you find families have to send children, of course 5 years. That's why the incidents are common among that age category. They have to go and fetch water because of maybe lack of access to clean and piped water. So these families end up sending children to ponds, to wells and rivers. And of course, being children and unsupervised, they end up drowning.
To ensure effective reporting and preventing drowning, Justice for Development Council has held a consultative meeting with news editors from different media houses to support journalists on disseminating information to the community. Stephen Paul says there's need for policies to be put in place by government. Drowning is a major public health issue where Uganda has one of the highest global drowning rates. It is common among young adult males living among lakeside communities who carry out boating-related activities like fishing, most at risk.
Of course, there are very many interventions that could be put in place to prevent drowning, including like training individuals how to swim, improving our response rate, especially with those ones concerned in search and rescue. Of course, our response time matters, and it doesn't take a lot of time for someone to drown and die within the water.
Reporting for BC TV, Helen Barbara Gizamba.